Hello, everybody, and thank you all for coming today. I am Houda BOUHISSI from the University of Jaya in Algeria. Today, I present our paper entitled HelpDiabeto, a user-friendly tool for diabetes tracking and monitoring. In today's presentation, we are going to cover different points. First of all, I will be looking at diabetes disease and its complications. Then I will move on to related works. Thirdly, I will discuss the proposed tool in detail. And finally, we will finish by looking at conclusion and some perspectives. According to the World Health Organization, diabetes is one of the leading causes of mortality worldwide. In 2019, diabetes affected more than 463 million people in the world, including 59 million in Europe. Usually, to monitor diabetes by patients, doctors distribute small notebooks for them to record their daily intakes, allowing for later assessment after a specified period. However, there are several difficulties associated with this approach, especially during healthcare crises such as coronavirus, including, for example, patient lacks education, the patient doesn't regularly monitor his blood sugar, the patient has difficulty with mobility, the doctor struggles to manage all his patients, and the lack of communication between doctors and their patients. In this context, our work aims to develop a therapeutic monitoring platform for diabetes patients. This application will provide doctors and patients with a comprehensive and user-friendly tool to record and track glucose levels, medications, and medical appointments. There are various health-related applications available on smartphones and other wireless devices to assist individuals with diabetes. These applications were designed to aid those who need to make lifestyle changes or adjust their medication based on glucose monitoring data. Here are some of the main applications in use and available on smartphones. These apps were selected according to their download rate. Many of these applications enable diabetes management with diet recommendations, while some allow notifications to be sent through alerts. However, these applications require a high level of involvement on the part of the patient. The tool is called HelpDiabeto, which is an application designed with the unified modeling language and implemented with Python language, specifically for doctors and diabetic patients. It aims to facilitate the daily monitoring and tracking diabetes diabetic patients, helping them better manage their condition and improve their life quality of quality of life while providing doctors with real-time access to patient data. The application involved three different user groups, as illustrated in the picture: doctors, patients, and administrators. Each user has specific functionalities and requires a password for access. The proposed application will be installed in a data center in the healthcare services and connected to physicians and patients' devices uh, like personal computer, smartphone, or connected devices. The main features of the application include, for example, assisting attending physicians in accessing medical information, such as reviewing blood glucose test histories to improve the quality of medical care, offering digital assistance through a user-friendly interface to help patients to manage their medical journeys anytime, anywhere with ease and confidence. Sending regular reminders to patients for timely medication intake, saving blood glucose measurements for remote consultation, reducing the need for unnecessary travel, thereby minimizing costs, facilitating proper interaction between doctors and their patients, enabling effective medical monitoring of health status, and other functionalities. So the first image presents the tool interface. The administrator can view precise diabetes statistics by province, by type of diabetes, by logging into the appropriate interface. These statistics provide detailed information about the prevalence of diabetes in each province, as well as the distribution of diabetes type 1, type 2, etc. This data allow the administrator to understand the geographic variance of diseases and adapt diabetes prevention and management programs according to the specific needs of each province. Patients have restricted access within the application, allowing them to view appointment times and input glucose measurements. Additionally, patients receive periodic notifications related to meals, blood sugar levels, and medication. The central user of the application is the doctor. The doctor can perform tasks such as adding a new patient, reviewing list of his patient, accessing the appointment list, checking personal schedule. Moreover, the doctor can customize the patient profile. For the first visit, the doctor introduces all the patient's useful information, such as name. That means the doctor who registers his patients. So he introduced name, medical history, age, and each check-up. Uh, at each check-up, the doctor also records the results of the various tests and analyses. This enables the doctor to monitor the patient's progress and detect any anomalies. So the doctor uh, have some functionalities such as medical record, care, reports of the useful information about the patient, insulin dosage, uh, To conclude, HelpDiabeto is a platform developed in Python and was created in 2023 and has been tried and tested by a population of 3 doctors, each of whom follows around 4 patients. The doctors expressed their satisfaction with the use of the application, especially in times of real-time uh, information and efficiency. Also, the patients uh, have limited education and cannot manage their disease individually. For patients, using the applications is not a big deal since all time they receive notifications. They only record their glucose level, which is sometimes registered by a glucometer. The deployment of the applications generates datasets comprising information from diabetes patients, which will be useful for various applications. To conclude, our application will continue for any improvement. Uh, for example, we plan to to add prediction model and hyperglycemia and hypoglycemia prediction. Finally, I am coming to the end of my presentation. I hope this has been informative and useful for you, and would like to thank you for your attention. Feel free to ask questions. You are welcome.